Good morning. This is Melody Pazalt from the Division of Behavioral Health and Recovery at the Healthcare Authority. We will get started in just a few more minutes. Good morning, everyone. This is Melody Pazalt from the Division of Behavioral Health and Recovery at the Healthcare Authority, and I will be the presenter today. It's been a while since I have presented on the monthly topical webinars, but very glad to be sharing some tools and resources to help individuals and agencies pursue their employment goals and help people be successful in employment. We hope that these tools and resources will be helpful, and so wanted to just give you a preview of some of these resources that you may not be aware of. And so we'll get started in just another minute or two, let folks log on to the webinar. So thanks for joining us this morning. Just one more minute and we'll get started as folks are still logging into the GoToWebinar system. And so welcome again to our monthly topical webinar for the Division of Behavioral Health and Recovery and the Healthcare Authority. Well, why don't we go ahead and get started? Lots to go over this morning. Want to share some tools and resources that we've been developing over the years in preparation for delivering supportive housing and supported employment services. We hope these tools are helpful, and we're always open to suggestions and ideas. My name is Melody Pazalt. I am currently the Acting Assistant Deputy Director of the Division of Behavioral Health and Recovery at the Healthcare Authority, but previously I was the Recovery Support Services Supervisor and the Section Manager of Behavioral Health Programs and Recovery Support Services at the Division of Behavioral Health and Recovery. Before that, I have been, most of my career has been spent helping people with employment, whether or not they have serious mental illness or developmental disabilities, or people that are homeless, or people with co-occurring mental health or substance use issues. And so I'm very passionate about helping individuals obtain their employment goals. And so when I came to the Division of Behavioral Health and Recovery almost 8 years ago, it's hard to say that that's that long, really wanted to try and provide communities with resources. And so we're very fortunate to have a lot of partnerships in developing these resources over the years. And so I just want to give you a quick overview of some of these resources and tools. And again, hopefully, if you have ideas of what your needs might be, that you're in touch with some of our foundational community supports trainers, AmeriGroup, our ALTA staff, and we can continue to try and develop more resources and tools for providers and individuals in the future. So just this is kind of an open dialogue, and just keep us posted with what would be helpful. So I'm going to dive right in. So we're very excited to say that January of 2018, we launched Foundational Community Supports through an 1115 Medicaid demonstration waiver. We are working with AmeriGroup, our contracted third-party administrator, to contract those services and manage those services in the community. And so if you're not familiar with AmeriGroup, this is a great website that they have that has lots of access, lots of information on how you can either refer people or become a contracted provider. There's also a public-facing website for individuals who might be interested in accessing these services, or if you're an agency that wants to refer people, this is also a great tool to be able to give individuals information about foundational community supports. How we got to this, after a year of implementing, getting ready to implement foundational community supports, it took many years to get ready to launch those services and to have this as a Medicaid reimbursable service. And I'm very glad to say I ran the numbers yesterday, and we have almost 3,000 individuals, or 2,999 individuals enrolled in foundational community supports, about half in supported employment and half in supportive housing, a little bit more, probably kind of a 60-40 split between individuals enrolled in supported employment to those enrolled in supportive housing. But it's so exciting to see those numbers continue to grow in just a short one-year time period. We have about 90 agencies currently under contract with AmeriGroup. We're always looking for more agencies that are interested in delivering these services. But to get to that point, to get to the place where we are now have supportive housing and supported employment as a Medicaid reimbursable service, it took a lot of work and a lot of stakeholdering and a lot of resources, and so some of that is due in part to the Chronic Homeless Policy Academy and the Olmstead Policy Academy. And years ago, in 2013, we actually brought together a group of stakeholders to develop a strategic plan on how to improve the employment rate for people with behavioral health conditions. And then with the Chronic Homeless Policy, it was how do we end chronic homelessness in Washington State? And so those two strategic plans have really been sort of our North Star in pursuing these resources and all of this information. And so a lot of these strategies that you're going to see in the next several pages, and as well as the tools that I'm going to be showing you or demonstrating today, will be basically some strategies that came out of those strategic plans. And if folks are interested in those strategic plans, I'd be happy to share them. They were quite ambitious, with probably over 150 action steps and strategies on the strategic plans. So I don't want to go through those. We do need to refresh those strategic plans and begin thinking about what do we want to accomplish in the next 5 years. And so lots of work still to do, and lots of opportunities to provide input. Somebody's asking a question about getting a copy of the PowerPoint, and I will actually send the PowerPoint. I'm going to also show you where we post and where everybody can access all the materials from all of our monthly trainings that we do. So that's one of the cool projects that I'm going to show you today. So I'm going to quickly go through some of these things. We've been busy over the last several years. One of the things that we did in preparation for launching the services, the Foundational Community Support Services, is we actually had a series of Medicaid academies to really teach agencies, that non-traditional agencies, on how to deliver Medicaid reimbursable services. We also created a decriminalizing homelessness toolkit, because a lot of times people that are homeless are up against added challenges of having justice involvement, and communities, we see that sometimes the laws in communities that perpetuate homelessness, like camping in public, things like that. And so there's some resources and a lot of great information on this toolkit around how do we decriminalize homelessness. We also changed the rules. We changed the licensing rules for how agencies are licensed. Our community behavioral health agencies are licensed to deliver supportive housing and supported employment services, and we added that certification to agencies to be able to deliver that. We did a feasibility study on tiny homes. We did analysis of coordinated entry assessment tools across the state. We developed a housing resource guide around trying to help people navigate the different funding trickles that can pay for housing. We added modules to the Pathways to Employment. I'm going to walk you actually through the Pathways to Employment. We've actually developed a Pathways to Housing version of the Pathways to Employment. We've developed these wikis, and I'm going to walk you through our wikis that are really online libraries, essentially repository of information that anybody can access around resources, information, online dialogue, sharing of information, being able to network with other folks, post announcements, that they're really just these great opportunities of having a centralized location, a repository of information. Washington became one of the, we became the 19th state to join the IPS, Individual Placement and Support Learning Collaborative, learning community. The IPS International Learning Community actually is now over 25 or 30 states, as well as 3 countries that are all committed to implementing the individual placement and support model of supported employment. And so we work closely with the and learn from all of the other states, as well as the national technical assistance through IPS. One of the other things that we did in preparation for getting ready for implementing supported employment and supportive housing is we created a guide to help agencies document supported employment with a Medicaid lens. We know that this is new and challenging for some agencies on how do you provide these services through insurance reimbursement. So Medicaid is an insurance, and so how do you document that with an insurance lens? We also have formulated a learning community approach to continuous quality improvement. You may have heard about our fidelity reviews or our fidelity reviewer trainings, and essentially that's where we really want to help agencies learn from each other and facilitate that process of having a fidelity review to see how closely you're following the recipe of the IPS model, but also be able to cross-pollinate that with other agencies so that agencies can exchange information and ideas about how to follow this recipe, because if you follow the recipe, you get better outcomes. We also have been piloting our housing and recovery through peer services with subsidies for individuals exiting or at risk of entering inpatient behavioral health settings. So we have some financial resources to be able to help pay for first and last month's rent. We also work very closely with Department of Commerce, who also has some long-term subsidies for folks exiting or at risk of entering inpatient behavioral health settings. So we know that when we're delivering the supportive housing services, that the services are awesome and great, but we also need the subsidies to be able to pay for the rent. We think that that having peers deliver supportive housing and supported employment services are also a fantastic career pathway for individuals. So in Washington, we have been promoting and helping develop peer services since 2005. Peer services have been a Medicaid reimbursable service for many years, and so we have a number of people that have gone through the certification and training to become a peer. And so now we want to think about how peers can have career pathways, and we think that employment and housing could be part of those career pathways. And so how do we continue to educate our peers? And so we've created a 4-part supportive housing curriculum, and that is hosted not only on the University of Washington Workforce Learning Collaborative site, but it's also on our Pathways to Housing site. And then we have a supported employment curriculum that's we have 3 modules actually completed so far, and that is on our Pathways to Employment, and I will show you where that is actually at. We think that getting employers to hear about the benefits of hiring people with behavioral health conditions is good business sense, and so we contracted with the Thurston Chamber to launch a anti-stigma campaign called Great Minds at Work. And so we have brochures that agencies can use, marketing information that agencies can use to actually go and talk to employers about hiring people with behavioral health conditions. And so those brochures are available to anybody to use. And so I'm going to show you on the wiki where you can actually download those brochures and be able to use those for your own job development efforts. We think that stories are incredibly important in telling how impactful employment and housing are to people's recovery. And so we actually have a really nice site on a Weebly site that has stories for housing. I do need to add our employment photo voice. We do have the photo voice project on the wiki. And these are basically where we've given people cameras, participants in our programs, and we've given them cameras to ask them to record from their perspective what life was like before employment, what life is like after employment, and the impact that employment had on their life, as well as what was the role that the peer had in helping influence them on their recovery. We continue to promote training. We've had our 2016 Great Minds at Work Employment Conference. We had 165 people in attendance. We just had our 2018 Great Minds Employment Conference, and we had over 240 people in attendance. We have monthly housing webinars, monthly employment webinars, which is what you're on today. And we also have a monthly job development learning community call that we do and facilitate. We've tailored supported employment marketing materials for individuals. We've created a hospital discharge planners toolkit. We've done a lot of pilot projects to get ready to build the capacity of communities to implement these services. And we also always have an evaluation on the impact of those services. And so research and data analysis writes these fantastic reports with around the evaluation of the effectiveness of these services. And so if you are really an insomniac and need some late night reading materials, these reports are really amazing. So Porch was a supportive housing project. Bridges was a supportive housing and supported employment project. We also are doing one on our Becoming Employed Starts Today. And we also did a TANF supported employment pilot, and that report is just about to be released any day. We also took a retrospective look back at when we used to provide supported employment services and what was the impact. And what we found was that we reduced arrests. People were more likely to get engaged in outpatient behavioral health services, and our employment rate went up. And so those are important things because we are required by the legislature to demonstrate our outcomes. And so you can always go and see what our outcomes are like. And in 2014, before we expanded Medicaid, our employment rate for people in the behavioral health system in outpatient mental health services was about 10%. And so that has now significantly increased, in part, I believe, to our focus on employment as well as the expanded Medicaid. So we're definitely seeing some increases in our employment outcomes, and I think that there's a lot of contributing factors to those outcomes, but we are headed in the right direction. We also work very closely between all of our projects. So the Recovery Support Services team that Tisha Kirschbaum is the supervisor for includes just an amazing group of people. We have Lisa Bennett Perry, our supported employment lead on training. We have Don Miller, our East Side supported employment trainer. Amanda Poley, our East Side supportive housing trainer. Kimberly Castle, our West Side supported employment trainer. We have our peer support team with Patty and Jen and Mary. We have Wanda Johns, our HARPS program manager, and we also have our homeless outreach programs, that PATH and our StarPair Pathfinder project. So we have a fantastic team that's really focused on bringing housing, employment, and peer services all together. So lots of things happening. So lots more to come. So you can see from a lot of those strategies that we are working hard to have a continuum as well as tools and resources and services that agencies can get paid for to help people with employment and housing. In addition to all of that, we also have national technical assistance available, and they've been doing a lot of the webinars around housing and employment. And so I'm fortunate to be able to revisit and come back and show you some of of these resources. So let me switch gears a little bit, and I want to show you the Pathways to Employment. So the Pathways to Employment site is, and you saw from that overview that we had some pretty significant updates to the Pathways to Employment in preparation for delivering supportive housing and supported employment services. I think this is probably one of the biggest hidden resources in Washington that a lot of people don't know that it's there. We hope to continue to expand it and offer more resources on this site, but it is just really a plethora of tools and resources that a lot of people aren't aware of. So hopefully, as I walk you through all of these tools, that you will bookmark this page, if you're on Google Chrome like I am, all you have to do is actually just hit to bookmark that or copy that URL onto your website and put it onto your desktop, because I access it all the time. You can also just Google search for it, and it's DSHS Pathways to Employment. So the Pathways to Employment was actually created, the gentleman that actually had the idea of creating this Pathways to Employment, who really deserves all of the credit, is a gentleman by the name of Steve Kozak. And he is here at the Healthcare Authority, and he was the lead on what was called the Medicaid Infrastructure Grant. And it was an opportunity to use Medicaid funds to help promote employment for people that was on Medicaid with disabilities. And at the time, this was in the probably early 2000s, largely part of the Ticket to Work, the Work Improvement Act of 1999, that helped promote Medicaid buy-in programs, as well as, so there was a lot of things coming out at the time, and there was a couple of national sites that were sort of benefits planner. WorkWorld was one where it was kind of a calculator, and you could go in and you could calculate how working affects benefits, but you had to start paying for those. And so Steve used the Medicaid Infrastructure Grant to actually contract with Research and Data Analysis and to build our own benefits estimator site, calculator site. And so RDA took on that challenge, and it has now been actually a model for the country, and there are other states that have actually asked Becky and David over at RDA to share how they developed the Pathways, the benefits estimator. One of the very cool things about our homegrown Pathways to Employment site is that because it's with Research and Data Analysis, it is actually connected to eligibility at DSHS. So they are able to extract real live, updated eligibility information to extract how working is going to affect your benefits. And so it's not just general information. It actually is really keyed into. It is actually really keyed into the ACES system at DSHS. So there's lots of features. So before I kind of jump into all of these different modules, there's this really nice guide on here on how actually to use this site. There's a glossary of terms. There's an email that you can actually email and ask them questions. There's a Q&A. There's also a brochure. So if you are interested in printing out and having these brochures available at your organization, you can actually print out those brochures. You can also sign in to create your own account, and this is really cool for individuals who might be interested. You might be sitting down with an individual and talking with them about going to work, and they may be very fearful about how working affects their benefits. And so you can do different scenarios with that person, and that person can actually create an account, and all of that information is kept silent. It's actually confidential and nobody can access. And so I have created an account for myself. The other cool thing about this site is that you can create a resume and a cover letter, and very different than if you've gone to go to a WorkSource office. You oftentimes get a flash drive at a WorkSource office to store your resume. Well, if you lose your flash drive, that can be really challenging. And so this allows you to actually store your resume and your cover letter in your account. So wherever you log into, you can always have access to your resume and the benefits estimator, where you left off with the benefits estimator. So there's lots of features in this. So just to quickly kind of walk through the modules. So the benefits estimator actually walks you through how working may affect your cash benefits as well as your medical insurance. And it gives you resources on some of the work incentives that may be available. I already mentioned the resume builder. Not only does it have a resume builder, but it also has a cover letter. The Work Near My Home feature actually is just an amazing, cool feature that gives you an idea of what are some of the businesses that may be close to where you live. So if you have somebody with limited transportation options, sometimes just even knowing what's in their own neighborhood can be a great tool in thinking about helping that person think about employment. There's a veterans page, a behavioral health page, and again, we'll go through these a little bit more in-depthly. There's a justice involved page for people that may have experienced criminal justice involvement. There's a youth in transition page, a page for vocational rehabilitation. We have success stories, more information. The individual work plan is tied to the Ticket to Work program. The continuing education are those peer modules for peers. And then we have a plethora of information on the IPS, Individual Placement and Supported Employment Model. So let me just walk through each one of these just a little bit more in-depthly. The benefits estimator on the pathways to employment is really, it's not full benefits planning. If you have somebody that's really anxious about how working is going to impact their cash benefits or their medical insurance, this is a great intro to those scenarios, and you can give people options and choice and control over how much they want to work, how much they want their governmental benefits to be impacted. So it really is giving people power and control over the decisions around going back to work, and really educating people about how working impacts. We believe, and the research shows, that going back to work is healthy for you. Being unemployed for long periods of time is very bad for your health, your physical health, your mental health. You're more likely to use substances when you're unemployed for long periods of time. So we know that being unemployed is bad for your health. Being employed and helping people go back to work is healthy, but how do we do that so that people are educated and informed about going back to work? And the benefits estimator is that great opportunity to give people some of those options and educate them about and address some of the myths that are out there around going back to work. We also, just as an aside, so Lisa Bennett Perry and Don, we've received some funds from SAMHSA, and so we are actually going to be launching some regional and some webinars around the basics of how working affects benefits. And so stay tuned. That we actually will be doing a lot more basic education on how working impacts people's governmental cash benefits. So as you walk through this, it asks you a series of questions. I've just thrown in a little bit of scenario for myself as a demonstration. It asks questions about your spouse because that also impacts your cash benefits. It asks you about your income. So if I'm receiving SSI right now, and also what your spouse's income might be, or if you have children in the home, if they receive SSI or TANF, it's going to give you information for the household. It's going to ask you, how much do you want to earn? What's that scenario look like? And this is where you really get to play around a lot with, well, what if I decided to go work part-time, just a few hours a month, let's say 8 hours a month, and I'm going to be earning $400 a month. How will this impact my cash benefits? It also shares with you information about different work incentives that Social Security have created. And you can actually have a little pop-up, glossary pop-up, that tells you about such some of those work incentives, like the impairment-related work expense or the blind work expenses. And then if you even want to go over here to this miscellaneous calculator, it's going to give you even more information about how that work incentive can actually even have a bigger impact and on the positive side around being able to work and maintain some of your governmental cash benefits. So again, this is a tool to be able to have those discussions with that individual and do some pre-planning around how working is going to impact a person's benefits. So let's run the estimator. And so it's going to say, if I have SSI now at $771 and I go to work at, and I earn $400 a month, my new SSI check is going to be $592. But I'm going to make out ahead with a total combined income of $992. So again, this is just an estimate. It's just an opportunity to run those different scenarios and give people options about how they would like to go to work, how much they want to earn, how many hours they want to make, and so forth. So it gives people choices and control. It also walks you through, so based on this information, you may be able to keep your Medicaid benefits through the 1619B program, through SSI Medicaid, which allows you to actually continue to work. Even if you no longer receive a cash check, you can still receive SSI Medicaid through the 1619B program. There's also the Healthcare for Workers with Disabilities program, and there's also an SSI-related Medicaid program through the Healthcare for Workers with Disabilities. As another aside, so there's actually, for folks that may not be aware of, there's a bill in the legislature right now, House Bill 1190, that actually eliminates any income restrictions for the Healthcare for Workers with Disabilities program. And this will be a teaser for you to come in and check out if you're not familiar or heard about the Pathways to Employment, or the Healthcare for Workers with Disabilities program. This is our state's version of a Medicaid buy-in program. And if you have somebody on spend down, this is a fantastic tool because this allows a person to go to work on SSDI and purchase Medicaid and it completely eliminates the spend down. So Healthcare for Workers with Disabilities is another tool in the toolbox that employment programs should be aware of. And here's more information on how the Pathways to Employment Benefits Estimator helps that person think more about what their options are in terms of going back to work. So that's kind of walking you through the calculator. The resume feature on the Pathways to Employment site, again, walks you through these tabs to, what's your main contact information, tell us a little bit about yourself, what kind of experience do you have? I threw in just a little bit of information, worked for Fred Flintstone for a while and Marge Simpson. Education, awards, references, and then it allows you to basically generate a PDF version, and you come down here and click on it, and it generates the resume for you. So great feature. When I applied for a job not long ago, I used this feature on the Pathways to Employment site. Also, if you wanted a one-page resume, or if maybe it's a young adult, if it's their very first resume, so you can actually tailor the resume feature to include information about high school or your references. It also gives you some tips and tools around which resume should I choose from. It also has a cover letter feature with some sample cover letters. And so, again, lots of tools in your toolbox. The Work Near My Home feature is actually one of the very cool features about Pathways to Employment. When I was an employment specialist and I was helping somebody think about going back to work, I would oftentimes drive around their neighborhood to talk with them about employment and what they might be interested in. And this feature actually does that for you. Essentially, you can put in your address, and it's going to tell you all of the businesses that are close by that neighborhood. And you can kind of walk through them. And so they're all listed here over on the left-hand side. I thought this was very interesting. The costume place. So if I had somebody that was maybe interested in the theater, I didn't know that there was a costume and mask and petticoat place within walking distance of where we're at here at the Healthcare Authority. The other feature that this has is some transportation options. So we know that sometimes transportation can be a barrier for people going back to work, and so this provides that link to what are some transportation options in that person's community. The veterans page again has some resources. One of the cool resources here, and I always encourage people to talk to individuals and don't generally ask people if they're veterans. Not everybody identifies as being a veteran, but ask that person if they've ever served in the military. And you can also ask what was their job in the military. And this tool actually is a translator. So it says if they were whatever their MOC was in the military, it actually then gives you ideas of how those skills can be transferable out into the civilian world. So there's some tools around military. There's also some information about the National PTSD Center, some other employment resources for people serving in the military. So lots of information on this site. The behavioral health module, we really wanted to try and share with individuals about the importance of work in people's recovery. And so we created this module to really show how important employment was with people's recovering and getting back into the workforce. And I think so often in the people with behavioral health conditions start losing their identity as an employee or as a person in the community and start identifying with that diagnosis. And so how do we remind people that they have skills and strengths and talents, and that the diagnosis is not who they are, it's just something that they're experiencing at this time. And so to really remind people that they have skills and strengths and talents, and that this is that going back to work is part of that process on their recovery journey. So how do you get started with employment? What are some things that are other things that somebody may need if they've been out of the workforce for a long time, or maybe have never been in the workforce? And so how do you get your food handler's card? How do you get a Social Security card? What about if you don't have a high school diploma? How do you get a GED? What's this practical guide for people who want to work are just really some ideas about how do you get started going back to work. What if you've lost your license? How do you reinstate your license? So these are just some really basic tools to help people think about going back to work. We also provided a lot of other tools and information and some of the different systems that help people go back to work, like the TANF system and the one-stop system, like our WorkSource centers. Those are great resources to help people think about going back to work. But for people with behavioral health conditions, it can also be a little scary. And so how do you talk about being out of the workforce? How do you talk about or do you talk about or just choose to disclose whether or not you have a behavioral health condition. And so we, again, wanted to give people power and choice and control over that decision. It's a very personal decision about whether or not they want to disclose. But we also want to inform people what their rights are with regards to disclosure. When do you disclose? How do you disclose? How much do you disclose? And so there's a lot of information here on this tab that really talk about those choices and how to do it, when to do it. One of the biggest tools that we have is the Job Accommodation Network, as well as the Northwest ADA Center. And those are some great tools and resources that we have linked here to help people make those decisions. Justice involved. If a person has some experience with justice involvement, there are a lot of resources and information to help people. But one of the biggest things, again, is how do you talk about that to an employer? And so, again, we've got information. We built out this whole module around how do you get started. Again, there's tools like the bonding program. A lot of people may not be aware that this bond, if you've ever heard that somebody's bondable, that means that it's somewhat like an insurance policy for the employer. And so, but it's a work incentive that individual can go to the employer and say, I'm bondable through this federal bonding program. And so you can click on the link and be able to have more information about the bonding program and how it can help not only people with justice involvement, but people that may have other barriers to employment or maybe not have ever worked before. And so the bonding program is another, again, cool resource that a lot of people aren't aware of. So I'm on justice involvement. Again, other resources around, so the reentry, a lot of great things about reentering. One of the information that we've learned through the years is that employers are not necessarily experts on reading a background check. And oftentimes there are mistakes on background checks. And so really encourage individuals to actually get copies of their background check. So when they go into an employer and talk about having some justice involvement, to really know what's actually on their record to be able to talk about that to an employer. So oftentimes what happens is you may have been picked up on a charge. That charge is going to show up on your background check, even though you may have never been convicted. It's also, sometimes people are victims of identity theft. And so I had an employee who went to go to a training on McNeil Island, and we had to have background checks before we went to this training, and somebody had stolen her identity, and she couldn't go to that training because there was a background check that had information, and so we were able to clear it up. But it's really important to help people get copies of their background checks to see how, what's actually on there, and to actually even work on getting it cleared. So these are some tips on how to do that. And then it's actually, how do you talk about having some justice involvement to an employer? And so how do you disclose that information? So we actually created a template to help people think about how do they talk to an employer. And so it's really kind of this, I did this, this is what I learned from it, this is how I can be a productive member of the community, and this is some resources and information that can help you as an employer. And so to really give people some tools on and format and structure on how do you talk to an employer. And so this disclosure speech is an example. You can also save it. You can tailor your own speech, and then you can actually print it off so that person actually can be able to go and practice it, or be able to take it with them on the interview. So again, just another tool in the toolbox for the individual as well as for the employment specialist. Youth in transition, a lot of youth in transition. How do you get started if you don't have work experience? What do I want to do? And so to really help youth think about going back to work. And so there are a number of things. How do I get an ID? How do I get a Social Security card? What are, again, how do I think about going back to work? Interest inventories that might be helpful. There's a lot of great tools and resources around education and training programs that can be very helpful for youth. How do I actually deal with my emotions, through this time period? So how to succeed in college. So there's lots of different tools on this site that are really geared towards youth. Vocational rehabilitation. Our state Department of Division of Vocational Rehabilitation is a fantastic tool and resource, especially for youth. 15% of DVR's funding has to be dedicated for youth in transition, including pre-employment prep. And so there's a lot of great resources on the Division of Vocational Rehabilitation. And so this is a little bit of information about DVR as well as a link to their site. Success stories. If you're a person with a disability thinking about going back to work, or you're an employment specialist working with somebody that's really ambivalent about going back to work, sometimes just seeing and hearing some success stories can really help that person make that decision. And so there's a number of links here to people that have gone back to work. One of the really cool ones, two cool ones that I want to promote are the Stability Network, which is essentially a group of professionals who are coming out and talking about their experiences with mental illness and behavioral health conditions. And so these are folks that are across the country that are coming out of the closet, if you will, around their experiences with mental illness. And so if you've not heard or seen some of the stories, the Stability Network is actually a very powerful, and oftentimes you can go into more details about people's stories. I've heard Catherine Switz talk. I've heard and know Topher personally, and just have some amazing, I know Haley, just some amazing stories of recovery and from leaders in our communities around. And so being able to share that with individuals to say you're not alone, and that there are other people that struggle with these symptoms of this illness, and you can still be employed. The other one is the I Want to Be video, which was created, it's a little older, but it was created by the Division of Behavioral Health and Recovery, completely focused on people with behavioral health conditions going back to work. And so that's Governor Gregoire does the introduction, but once you get past that, there's some amazing stories and the power that employment had in people and transforming people's lives. A lot of other great resources and information, some national, some from Washington State. So there's great to show in a group. If you're having a group and want to talk about employment, you can actually use these, and these links are available to the public. More information, more information, more information. So I'm always sending RDA links and information to add to the site. We want to continue to build this out and provide individuals and employment specialists with as much information as possible. The basics of how working affects SSI and SSDI, otherwise known as the Red Book, are just really easy reads if you want to know more about how going back to work is going to impact somebody's cash benefits. Also, I really want to draw your attention to the SOAR conversation guides. So these were created by the SOAR stands for SSI SSDI Outreach, Access, and Recovery. It was actually created as a partnership between SAMHSA and Social Security Administration on how do we help expedite getting people onto SSI and SSDI. And you're probably asking yourself, like I did when the first time I heard, I'm an employment person, I want to help people get off of the benefits. Why would I want to pay attention to helping people get onto the governmental benefits? And what we found is that if we can actually reduce the time that it takes for somebody to get onto SSI or SSDI, and the national average is 5 years, if we can actually reduce that, maybe people wouldn't be quite as fearful of going back to work. And so with the SOAR model and using the SOAR information, there's actually on the SOAR website a free online training on how to actually expedite those applications. The national average in using the SOAR model is 100 days. So if we can change that from 5 years to 100 days, maybe people wouldn't be as fearful of going back to work. And the R in SOAR stands for recovery, and it's always saying that getting onto governmental cash benefits shouldn't be the end of the road. That shouldn't be the final outcome, because SSI and SSDI is still poverty. So the monthly cash check for SSI is only $750. That's still poverty. And so so how do we help people have living wages and help them to be full community participants, and that we have to change that mindset that SSI and SSDI should not be the final outcome of our system, that it really is just one step in that recovery journey. So SOAR created some conversation guides. How do you have that conversation with somebody? Now you got them onto SSI and SSDI. How do you help them maybe think about leaving, moving off of SSI and SSDI? And so it kind of gives you a walkthrough. How can you have that conversation with that person? It also gives you the answers. So how do you actually, so you start talking, open that conversation up, but how do you actually respond in a way? And so it gives people really the tools to educate people about some of those decisions. And so the SOAR tools, it also gives you a nice little flyer for your office and address some of the myths and facts. One of the myths I think that's out there is if you are in the application process for SSI and SSDI, you can't work. And actually, that's not true. That if you're in the application process trying to go to work, particularly if you're involved in a supported employment or IPS program, is actually going to inform the Social Security office, because SSI and SSDI is all based on not how much medical documentation you can provide, but really how does that disability affect your ability to work. And if you can articulate that in the application, and if you have information from your experiences of trying to work, that's actually only going to inform your application. So that's actually a myth that's out there around going back to work. So lots of tools on here, tools around healthcare, career planning, support tools, tools for employers, as well as tools for the job seeker. The individual work plan was actually created in this module to really think about the Ticket to Work program. The Ticket to Work program is anybody on SSI and SSDI 18 and up are eligible for the Ticket to Work program. The Ticket to Work program was really created by the federal government to help somebody think about going back to work and address some of the myths that were out there. And so the federal legislation, the Work Incentive Improvement Act of 1999, created the Ticket to Work program as well as the Medicaid buy-in program. And essentially, one of the fears and concerns that people have is if I start looking for work, there's some red flag that's going to pop up in the Social Security system, and I'm going to have a continuing disability review. Well, the Ticket to Work program actually creates this. If you assign your ticket to someone, and it creates a work incentive that says, if you assign your ticket to an employment network, then we will suspend any continuing disability reviews while you are working or in job search. And so that's a cool feature. And so as part of developing and assigning that ticket, you have to develop an individual work plan. And this is an electronic version. It's also a nice, cool tool just for an employment specialist to think about an employment plan, because that's really what this is it's an electronic employment plan. And if that, you can generate a report and potentially assign this to an employment network. So, again, more tools in your toolbox. The continuing education module is that online training that we developed for peers to think about, to help peers provide employment services. And so it starts walking people through, even though this is really geared for peers, anybody, it's going to help anybody think about employment differently and provide information, tools, and resources about how do you have those conversations with individuals about going back to work. So there's just a lot of great information with regards to these modules. And so we have 3 of 5 modules done, and they are posted here. These are not, they don't generate a certificate. You're not tested. I think there's some little learning modules in it, but there's no official certification. These are really just online continuing education tools. And last but not least is really a lot more information about the individual placement and support model of supported employment. So we have the IPS principles. We have a link to the foundational community supports at AmeriGroup, and being able to access who are those providers in your area that are providing foundational community supports. And then if you're in an agency that's interested in providing foundational community supports, we have just tried to load up a number of tools from sample forms to even, I believe there's even a job description to how to talk to somebody about disclosing. So just trying to give people information about implementing the IPS program. So lots and lots of information. So that's a quick tutorial of the Pathways to Employment site. I'm going to switch over really quick and try and talk quickly about our other tool in the toolbox is our wiki. So a wiki is that online community repository, and anybody can belong to the wiki. It is a member, and so you sign up to be a part of that. And when you sign up, like I said, anybody can sign up to be a member of this. It's completely open. The sign-up process is essentially you're notified when anything changes on the wiki, and so it gives you kind of a notice that, hey, something's been updated, something's been posted, and you can choose whether or not you want that daily or monthly. And so there's a lot of that's part of the sign-up process, is how frequently you want to be notified of changes to the site. This site was actually created as a result of the DVR actually convened a work group to think about how do we promote employment for the behavioral health population. From that, my my friend and colleague Mike Hudson suggested, well, we really need a central place that everybody can go and get information, as well as be able to share documents, and so Mike actually was fortuitous and found the PBWorks free site and really created the wiki. And so I credit him and his use of technology to help us continue to grow and implement supported employment throughout the state. So this kind of gives you just a little bit of information. We kind of took it over for when we launched the Becoming Employed Starts Today project, the SAMHSA grant, and have expanded it a little bit beyond our first initial mental health employment work group. So that's you'll notice. I think our first is Mental Health Employment Consortium was sort of the first component. So we have announcements over here on the side. We have our monthly topical webinars. We also have our job development community of practice. This is just a comment. Anybody can make comments. You see I am a loudmouth and made a lot of comments, but Wanda and Dawn, we post just information, announcements, tools, resources that we've heard about, and so there's a lot of information sharing just on this first page. If you notice up at the top, there's different tabs. So the second tab is Pages and Files, and very much like your own, C drive on your computer, your hard drive. It's sort of set up like a Windows, that there's different files that we've created for that repository of information. And I'm just going to scan through some of these really quick. So articles, news, and miscellaneous really is just that. It's just sharing articles, news, miscellaneous. If you want to hear more about impact of employment on for people with behavioral health conditions, or some interesting articles around employment, this is it's just some great a repository of being able to put that. Pat Deegan, I put this one on not too long ago. One of my favorite authors, and she has just an amazing story, and this is just such a great read. And so just being able to talk about having some information like that. I'm going to go back to the Pages and Files, hopefully. So the Becoming Employed Starts Today is a grant that we have from SAMHSA, and so there's some information about that grant and the projects associated with it. We also have information about Clubhouse services on here. We were directed by the legislature to do a report and convened a work group and it, issued some proviso funds to clubhouses, and so clubhouses are also strong proponents of employment, and so we have some resources and information about clubhouses. In 2011, when we used to have supported employment as a Medicaid service, we lost those services, and so we were very fearful of agencies closing up their employment programs, which we actually did see quite a bit of that. And we put on our repository, on our library, tools to help agencies pursue other resources such as grant writing. And so this file has quite a bit of information about foundations that have funds, as well as how do you write a grant. And there's actually a nonprofit technical assistance center here in Washington that helps nonprofits pursue grants. So that's a nice little file of information. The Great Minds at Work campaign, I mentioned earlier, this is our goal of trying to educate employers about the benefits of hiring. And so we contracted with some different business associations to help us from the business perspective market to other businesses. And so a few of those brochures are available here. So one brochure, the Great Minds at Work. So what you do is you go up here and you download that, and there's the brochure that you can actually print off and be able to use those in your marketing efforts to an employer. I also have a stigma brochure. I'm going to actually open this up in a new tab. And I just go and download it. And there's information about, again, the stigma of mental health and how an agency can actually do their own behavioral health stigma assessment in the workplace. So we wanted those brochures available for agencies to be able to download those and print them themselves. We do have some stockpile here still at the division, and we'd be happy to share those as our supplies hold out. Information about mental health and employment, again, just really try to provide sort of this repository as agencies may need to make that case internally to their agency. Why should we implement an employment program within our behavioral health agency? And so just wanted to provide a lot of tools and resources to have that conversation with your leadership within your own organization. We have job postings are not for postings for individuals for employment. It's really about agencies that may be hiring employment specialists. So I will tell you, actually, DBHR posted, we have a couple of positions, namely our Foundational Community Supports Program Manager and Foundational Community Supports Program Administrator position. And so these are really for agencies to be able to share and try and recruit employment specialists or program managers related, not intended to post job for individuals. That's really what WorkSource is for as well. So ongoing support, WRAP for Work is a really nice tool, and I think we're going to hear more about that in the years to come. If you're not familiar with WRAP, it's Wellness Recovery Action Plans. So that's a very cool tool for individuals to manage their coping, develop their own coping skills, and it kind of walks people through what those coping skills look like for that person. Photo Voice. Photo Voice is, I mentioned this earlier, it's where we actually gave cameras to individuals and asked them to record what life is like from their own perspective. And so we have our housing Photo Voice projects, but here is the BEST grant, the employment Photo Voice project. And so again, it really tells about stories from a person's perspective on the power that employment had in their lives. And so again, how important those stories are to people. Resources and helpful links, and this is the one that I really want to drill in, because there's a lot of great information around this particular file in and of itself. So resources and links from career development to how to get access to free cell phones, to information about the employment pipeline, to how working affects benefits. We have just a whole bunch of information about how working affects benefit. It's another place to get those SOAR conversation guides, some how to do reporting to Social Security, just quite a plethora of information on how working affects benefits, to how to get access to education and training. So how do you, if somebody has been a victim of a predatory school loan, how do you get that person out of default and into forgiveness or deferral? So there's some resources around that, as well as some best practices in supported education. justice involvement, some more information on justice involvement. But this one page down here called resources, and this page just has a ton of links. So again, if you want a central location on where do I go to get some information and some tools and resources, this is the page that I always go. And I actually last night went and double checked every one of these links and made sure that they were all up to date and still accurate. And so if you wanted information about AmeriGroup or AmeriCorps, apprenticeships, assistive technology, benefits planning, the Earned Income Tax Credit, the Self-Sufficiency Program, free computer tutorials. This is so awesome that people may not know that Microsoft has actually free online tutorials about how to use some of their software, like Outlook, Excel, Word, and if you have somebody that's going to be going, into employment, almost always there's going to be some computer work nowadays. And so if you have somebody that's a little concerned or worried about computers, there's these free computer tutorials. HUD earned income disallowance. I hear a lot from folks about worried about how working is going to impact their income. And so I clicked on the link, and now I think I need to close some links here first. So HUD actually has a work incentive called the HUD Earned Income Disallowance. There it is. So there actually is a whole guide on how to help people that are living in HUD housing with how working affects their benefits. So again, you get the idea that there's a ton of tools and resources. How do you get an occupational driver's license? How do you, again, some tools and resources. And so we've tried to just have that central location where you can go specifically around tools for people with employment. So I really wanted to share that one. The Ticket to Work program, we've been doing a lot to try and promote the Ticket to Work program in Washington, and you're going to hear more about from us this year. Again, we actually have a number of trainings that, I guess that little file, I need to update that. We had some actually online trainings that, this must be it, webinars that the Institute for Community Inclusion did for us. So these are all still available. These links should still be all live and available to help educate people about the Ticket to Work program. We also have trainings and conferences. So this is another one that I think that people will use a lot. So we have, of course, we do a lot of trainings and a lot of conferences. We have our Great Minds at Work conference. So all of the presentations from our conference from 2018 are all posted on here. If you weren't able to get to the conference, there's a lot of great information from the conference that's still here. We also, every month when we do these webinars, our monthly topical webinars, we post the information on our wiki. So if you missed January's, which was on the Child Care Subsidy Program, that PowerPoint is available online. And so I will post the information from today's webinar. That the first initial PowerPoint that I did is actually already on here around getting ready for employment. Lots of great information. Actually, I thought I posted it on here already, but we'll make sure that that's on here and that folks can access that. So again, really wanted to put this tool out there so that people have a central location that they can go and capture information. So have about 10 minutes left in the webinar, and I want to be able to open it up if folks have any questions about the information that I've gone through. I know I've gone through it very fast. And if there's ideas that you have that you'd like to see us either add to, or if you feel that there's some training that's missing or information that's missing, let us know. And we are kind of dogs with bones on trying to get information out to communities. So, so this has been great. How do we sign up for that wiki page? So, so that's a great thank you, Dina. And essentially, if you want to actually take this, I will take this link and I will post it to everybody in the chat box. And you can click on that link and it will ask you, do you want to be a member of this site? And it will actually send us an email, and we will grant you access to the site. And so anybody can be a member. And once you are granted access, you just go in and set up your profile. You set up your own password, and how frequently do you want to be notified of changes to the site. The Pathways to Employment site doesn't require any access or membership. It's just free and open to the community. So, any other questions that you have about Pathways to Employment or the wiki, or if you have any suggestions of trainings or information or resources that are needed? So if folks either want to type your question into the question box, or if you want to raise your hand, I would be happy to unmute you. So somebody raised their hand, but then they put it back down. Harvey, you're unmuted, Harvey.
Hi, I want to thank you. I already sent you an email, but this has been very informative and very helpful. And while you're talking, I kind of slipped off to the side already and put the Pathways to Employment on my my main screen. So I'll have it there because there's a lot of stuff that I really want to go back and visit. And I really like those the success stories on recovery that you have, and working with the Washington Recovery Helpline and the media campaign and the MAT locator database. You gave me some great ideas, so thank you.
Thanks, Harvey. We're always open to more. If there are other ideas that are needed, we're just really interested in what's the barriers in helping people go back to work. And if being unemployed is bad for your health, which we know it is from the research, what is it that's going to help that person go back to work and think about work? And so, what is it from, if it's shoes and tools and books, we've got resources that we can direct you. If it's, the support that you need to help that, to obtain and maintain that employment, we've got those services now available through Foundational Community Supports and AmeriGroup. So, what is it that is the barrier to going back to work? If it's justice involvement, are you familiar with the bonding program? Do you know how to talk to an employer about your justice background? And so it's really just trying to break down what that person's barriers are and trying to identify, and it can be overwhelming, all of the resources and information. And so that's really why we created the wiki, as well as the modules in the Pathways to Employment site, because it's actually it's sometimes too overwhelming, the information. So thank you, Harvey, and I appreciate the support. And so Dale says, can you send the link to the wiki in the chat box? So I did send that out to everyone. So hopefully you should either have it in the chat box or in response to the questions. And Dave, my buddy down in Southwest Washington, great training and great info. I will visit. Thank you. So just since I don't have a lot of other questions, what I will do is I will preview actually other things. So we actually have 2 more wikis. So we have a wiki on supportive housing, and we have a wiki for peers. And so those are some other wikis that you might be interested in. They're still being built out. The employment wiki has been around since, I think, 2008. So there's a lot more information on the employment wiki, not quite as built out on the housing or the peer wiki. Those are still really kind of in development. I also want to share the Pathways to Housing site. I think that that's also, it has been launched. So the Pathways to Housing site is another, it's modeled after the Pathways to Employment site with some different twists. And so the Pathways to Housing, rather than a benefits estimator, what we did was we helped people with budgeting.
And what video conference, and it's just ending soon, and talking about DVR. I thought about you, so I thought I'd just give you a call and see what you're up to.
I'm gonna mute you back. Okay. So the Pathways to Housing is really to help people think about how to budget for housing, and what actually is, what can they afford, which we know that there's a housing crisis, but to give people some tools around how to develop a budget. And so there's a number of tools on here on how to save money, how to budget, and some free budgeting tools, how to get your credit score. So there's some really cool tools on here to kind of, again, give people, educate people, and give people power and control over their own lives. Again, more information about credit, because that certainly has an impact on housing. One of the things that we notice in the housing side, just like the kind of the resume builder, is that one, people are oftentimes poor historians over their information, and so the Pathways to Housing created a generic housing application, so that person can have that historical information stored for them and be able to go back and revisit that and be able to print that off and be able to generate report like a generic application that they can keep with them. Our goal in the future is hopefully landlords would be willing to take this in lieu of their own rental application. So that would be the ideal situation in the future. So we kind of built that hoping for that possibility down the road. We provided a lot of information about what are supportive housing services, and links, of course, to the Foundational Community Supports Program and AmeriGroup. We also provided information about housing resources, like the HUD resource locator. This actually has links to where are affordable housing buildings in communities that have been built with HUD or tax credit resources. And so these are some great tools around, because there's other affordable housing other than what you might know of Section 8. There could be HUD 202s, 811s. There could be project-based housing that's been developed with public dollars. And some of those are, you may have a 100-unit apartment building, and maybe 10 units in that apartment building is actually set aside for people with disabilities or people that are low income. And these links will actually help you find some of those set-asides across Washington. Provider resources, this is the supportive housing peer training that we developed. We also have, again, trying to give tools to providers on implementing foundational community supports to the evidence-based practice foundational community permanent supportive housing. We have a veterans page, also a success page, know your rights around housing, to give people tools on their rights, as well as what's the landlord rights and what is fair housing. So Olivia asked, do you have any brochures designed for employers that explains the supported employment without disclosing about disabilities to be given to the given if the client does not want to disclose about their disability but would like you to advocate on their behalf? So yes, in the pages and files. Oops, I'm in the wrong wiki. In the pages and files, in the Great Minds at Work campaign, there should be a brochure on what is supported employment that doesn't go into what a diagnosis or a label. So there should be one of these, and I don't know right off the top of my head which one it is. And if not, please contact Lisa Bennett Perry, and we'll make sure, or if you want to send me an email, we'll make sure and get you copies of that that marketing brochure. Great question. So it looks like our time is up. Thank you all so much for your time today. I really appreciate it. I hope these tools are helpful. I hope you're are interested in using these. And again, if you have any ideas or suggestions of what's going to help you be successful with employment or help individuals be successful in employment, we're always open for hearing and trying to pursue resources. So thank you all so much for your time today. Have a wonderful day, and we'll hope to see you next month or hear from you next month, our next employment webinar topical call. So thanks, everybody.